Good morning, Prof. So today we'll be talking about our analysis on Alberta Blue Cross, and we are Group 9. So Alberta Blue Cross is a Canadian not-for-profit insurance company that provides health and wellness plans, programs, and services for the community. It's also known as the largest benefits provider in Alberta. So its philosophy. So for its mission, it is to support individuals to live your best life. They understand that living your best life can mean different for everyone. And so they want to provide communities with the tools and partner up with organizations to create programs that support wellness. Secondly, to be a trusted partner by providing protection, prevention, and care that makes a positive impact for the community. And they want to empower people to make their personal choices that affect their well-being and help them explore their overall health by providing customers with great products and services, which is their vision. And lastly, these are the 4 values that they follow. So for industry trends, we can think about AI. AI is artificial intelligence, which is a system that provides complex tasks relative to a human. In planning, Alberta Blue Cross is embracing the future of technology by using AI to prevent fraud. They use AI to detect benefits, fraud, which can involve individuals who submit false claims. They also examine large volumes of data from different sources to identify patterns and suspicious activities that they could indicate potential fraud. It has helped them allocate their resources effectively and provide better service for their customers.
And then for healthcare costs, it is known that healthcare costs are on the rise because of concerns such as aging population in Alberta, chronic illnesses, and drug costs. And the impact this would have on Alberta Cross is that Alberta Cross would need to weigh the cost of their plans against sustainability, and then they would also have to potentially restructure their benefit plans and negotiate favorable rates with their vendors.
The third one is preventive healthcare and wellness. One key trend in healthcare today is focus on preventive health and wellness. Instead of just treating illness, the goal is to help people stay healthy through things like healthy lifestyle choices and early care. For Alberta Blue Cross, this is a great chance to stand out by offering wellness incentive, mental health support, and health education. These services not only support our members but also help reduce long-term health costs.
Then for the SWOT analysis for Alberta Cross, we would start by looking at the strength. And for the strength, Alberta Cross is one of the largest benefits provider in Alberta, serving over 1.8 million members. Alberta Cross also offers a wide coverage of health benefits, which includes prescription drugs, dental care, vision care, and lots more. And they also practice strong partnerships and community engagement to promote health and wellness in Alberta as a whole.
Alberta Blue Cross is doing a lot of great things, but also we have a few like challenges to keep in mind. First, we don't have as big previous Alberta across Canada as some of the larger insurance companies, so we have to work on harder to stand out. The second one is some of our computer system are getting old, which can slow down us. So when we try to move to more digital ways of working. And the third one is since we are mainly focused on Alberta, changes in the province's economic or population that affect our business more than companies that operate across the country. Knowing these challenges help us to improve and grow strong.
So for opportunities, we can embrace technology to improve health services. So like I said, AI previously, we can also increase demand in healthcare. So, seniors, Gen Zs, or immigrants may have unique healthcare wants. We can also increase partnerships because they are a nonprofit company. As for threats, they do have competition with other health insurance, and economic factors such as inflation could affect their healthcare plans or affordability to customers. And there's also economic recession.
So, while assessing the external environmental factors that could affect our better course, we'll look at technology. And under technology, we have digital transformation of service. Our Better Blue Cross digitizing its services would also enable them offer better customer service, claims, processing, and also reduce operational costs, thereby enhancing overall customer satisfaction. Secondly, telehealth and remote services. With a rise in telehealth technologies, our Better Blue Cross has more opportunities to expand its coverage options and also partner with virtual care providers, which would also align with its consumers' demand for remote and convenient health services. And lastly, cybersecurity risks. Due to the fact that our Better Cross has access to sensitive personal and health information of its clientele, its high dependency on digital system could also come up as a negative factor, external factor. They would have to struggle with cybersecurity concerns, and it means that they would have to invest robustly in their cybersecurity infrastructure to maintain trust of their clientele and also protect their data.
So let's look at the economic environmental factors that affects the countries. So we will become the first company. Alberta's economy depends heavily on oil and gas. So when it slows down, people often lose jobs or earn less. This means fewer companies offer a oil health plan and fewer individuals can afford a private coverage, which lowers Alberta Blue Cross client base. At the same time, people may delay care, leading to worse health and higher claims later. More turn to public health programs, many of which we manage, adding pressure on our system. To respond, we may need to offer a more affordable plans for individuals and small businesses. Overall, the economy plays a big role in how we serve our members.
Okay, so for demographics, we can think about the aging population. So there's an increased senior population in Canada, for example. There's an increase of chronic diseases and increased preventative medication. Research from Beg and her colleagues published in 2009 highlighted that healthcare dependency increases with advancing age, with older adults using more medical services, prescription medication, and managing multiple chronic conditions. So this impact it has on Alberta Blue Cross is that they need to be able to adapt to insurance plans and benefits to address the evolving healthcare needs. For example, expanding coverage, medical support, and preventive care programs.
So, how would the company perform in next 5 years? So, our goal for Alberta Blue Cross is to become a digital leader in healthcare, offering easy access to virtual care and self-service tools. In the best case, we reach 95% digital adoption, improve customer satisfaction by 20%, and cut services cost by half. But if we don't act, we risk falling behind digital first competitors and losing client and revenues. To get there, we must overcome high technology costs and stay ahead of fast moving revenues. Our strengths are in engaged culture, strong training programs, and team ready for the change. Still, we face challenges like limited tech staff and possible resistance to changes, especially from long-term employees. We don't need, if we not plan ahead, we risk no moral and promise and missed opportunities. That's why we need to invest smartly, support our staff, and move boldly into the digital future.
So lastly, looking at reasons why HR planning is necessary in organizations. The first one would be it helps in matching workforce talent with organizations' business goals. It also improves employee satisfaction and retention. It helps in building an excellent workforce and also helps in forecasting future workforce needs in the organization. Then narrowing it down to how Alberta Cross plans on, incorporating HR planning for the success of the organization, we would look at the sustained employee professional development. Sustainability in professional development of employees is instrumental in improving their skills and ability to adapt to change. Thereby, Alberta Cross can also try to focus on leadership training and opportunities for mentorship for its employees. Secondly, environmental scanning and adaptation. Alberta Blue Cross can achieve higher success by analyzing their business environment, the health sector, to identify the current happenings and challenges and how the organization can keep up to the ever-changing business environment. HR analytics usage. By utilizing HR analytics, Alberta Blue Cross can effectively measure their HR practices and base their decisions on these results from the data. Building a really resilient workforce. This covers building a workforce where the employees are prepared to effectively handle the difficulties or intricacies of the healthcare workplace. Programs are geared towards resilience training, stress management, and employee wellness to help the employees feel better and also perform better at the workplace. Thank you very much.
Thank you.